Hello, my name is Phil Burke, and I am a physician assistant at Variety Care, and I'm currently the director of HIV and viral hepatitis services. I'm going to talk to you today about what is HIV, who is at risk for HIV, as well as who should get tested for HIV. So let's start with what is HIV. HIV is an acronym that stands for Human Immunodeficiency Virus. HIV is a special virus called a retrovirus that attacks the immune system, specifically a cell called the CD4 cell, or a T cell. So that cell, the CD4 or T cell, is very important in helping your body fight off infection. So what's a normal level? So a normal CD4 count is between 500 and 1,000, between anyone who's not HIV infected. That's just a normal level. If the CD4 count or the T cell gets below 200 cells, or a patient acquires one or more opportunistic infections, like pneumocystis pneumonia or Kaposi sarcoma, at any CD4 count, then HIV infection is considered to have advanced to AIDS. So what's AIDS? AIDS is actually an acronym for Acquired Immunodeficiency Syndrome. This is that period of time when you're less than 200 CD4 cells and it's easier for you to get sick. So what's a life expectancy? Normal life expectancy without treatment is between 0 and 10 years, which depends, of course, on the CD4 count at the time of the diagnosis, as well as whether someone is considered to be HIV positive or have AIDS. Overall, life expectancy of an HIV positive patient that is on ART or medication and linked to care is the same as HIV negative patients, although HIV positive patients are more likely to have more comorbidities, other things that make it easier for them to get sick. So is there a cure? Currently, there is no effective cure. Once people get HIV, they have it for life. But luckily, with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment, or ART, can live long, healthy lives and also protect their partners from becoming infected. All right, so let's move on to who is at risk. So these are groups of people that are at higher risk for HIV infection, or just at risk in general. So any person having unprotected anal or vaginal sex is at risk. Men who have sex with men are at risk, and we know that gay and bisexual men have had the largest number of new HIV diagnoses in the U.S. So although they're one of the main targets we see, they're not the only target or group at risk. Other groups at risk include transgender women who have sex with men, IV drug users, any person having sex with someone who's using IV drugs, any person having sex with someone who's HIV positive, as well as commercial sex workers. In addition, we do know that blacks and African Americans, as well as Hispanics and Latinos, are disproportionately affected by HIV compared to other racial and ethnic groups. So obviously those are groups that would be at risk as well. So now let's move on to who should get tested for HIV. So currently the CDC guidelines on HIV testing include once-in-a-lifetime testing for everyone aged 13 to 64. For those people at higher risk, the CDC recommends testing yearly. When we talk about higher risk, it goes up to the risk groups we talked about earlier above. So sexually active gay and bisexual men may benefit from more frequent testing every 3 to 6 months, but the recommendation is still once in a lifetime or annually if at higher risk. Variety Care currently offers HIV testing, prevention, as well as treatment. If you have any questions about HIV, you can visit our website at www.varietycare.org/UYOU or www.cdc.gov/HIV. Thank you. I'm Phil Burke with the Infectious Diseases Clinic at Variety Care Reno. If you need our attention, we're always available for you.